Today we're going to be talking about becoming a new patient at our practice. And so we've put together some questions and answers, and we're going to talk about that. So our first question for Aubrey is, are you, a patient, a good candidate for our practice? So what's a typical candidate at our practice?
Anybody. We love helping anyone in the community. It sounds like a broad answer, but we can. If you're looking for longevity, if you're an athlete, if you want to boost hormones, or if you have chronic illness and autoimmunity, we can help anybody. Basically, if you're living and you want a better life, we can help you. That's where you're a good candidate.
In family medicine, I'm a board certified family medicine doctor. And so in family medicine, we have the common phrase of womb to tomb. Doesn't matter if you're pregnant or if you're dying, you're potentially our patient. And so it's wonderful in family medicine that we can treat all of those patients. And we, as a family practice functional medicine office, not only accept any and every patient, but any and every disease or non-disease or wherever you're at in life, we've treated that type of patient. And so we want to encourage anyone that needs furthering their health, whether they're at that 90% performance and they're looking for that next 1% or 2%, like she mentioned, the athletes, or the person that's been struggling and their health has been declining for years and want to regain that health, you're a perfect patient for us.
Right.
So my next question is, who needs functional medicine?
Everybody needs functional medicine. It's another broad statement or blanket answer. Essentially, functional medicine, we help from the inside out. We help with the root cause. We do not believe in slapping medication on you or covering symptoms. We want to figure out, why are you tired? How can you boost that extra performance? We want to know the ins and outs. And ideally, any living human being would benefit from it.
And it doesn't matter where you're at in that health journey. So maybe you've already been paleo or AIP for several years and your health is doing well, but you don't know what's happening in your gut or you don't know what's happening in your arteries, and you want that testing to find out where you're at so you can take your health to that next level, because many people feel well with nutritional changes, but they're still hiding this beast underneath the surface. And if you never test, never fix that beast, ultimately 10, 20, 30, 40 years later might turn into something that you didn't see coming. Even though you were eating well and treating your body right, that thing can still catch you. One of the unfortunate things is cancer rates are on the rise, and one of the big reasons for that, we believe, is toxic overload. And so you can feel pretty good while still carrying that toxic burden on your back, and that toxic burden is sitting inside of your cells, sitting inside of your brain, your heart, your liver, wherever it may be, and it's only a matter of time before, unfortunately, that kryptonite turns into some damaging DNA and a cancer is born. So honestly, pushing your body into as healthy as possible to prevent those things is basically what functional medicine is all about. In our videos, we frequently talk about really sick people and mold and all these things, but it doesn't matter where you're at, whether you're 20, whether you're 80, you can get more out of your body than you're already getting with functional medicine.
Yeah, we have a great range of patients. We have the patients who come to us and go, I've seen every provider you can imagine and no one can help me. And we go, we know we can.
We got you.
And then we have the patients who come in here and go, I feel fantastic. I literally couldn't imagine feeling better. Then they come in the day after day and they go, I can't fathom feeling better and I feel better again. Please stop. I don't know how to live with feeling better. So we have both of that. We have a wide range. And so even if you're on that spectrum or this side of the spectrum or in between, functional medicine can always help.
I've had two patients recently that I ran into in the last week out in public, and one of them is 59 and says he feels 17 again. And another one, I don't remember her exact age, but she's over Medicare and she feels like she's in her 20s and 30s, and she feels better than she did in her 20s and 30s. So it's real, it can happen, but it's with dedication, right?
Absolutely.
So that was my next question of what types of issues do we see?
I mean,
anything and everything.
Yeah. It's another blanket answer.
We see all kinds of autoimmunity. We've got multiple sclerosis patients. We've even got things that we've never even heard of before, and then we have to go and research it. And that's one of our other questions. What is it? What if you've never seen someone with my specific condition? Well, luckily with the internet, there is medical databases. There's of course Google. And so even if we don't know your specific condition, usually your specific condition is still linked to one of the 5 causes that we kind of believe in functional medicine. In our practice, we focus on gut, biological toxins, environmental, that one's mold toxins, environmental chemicals, and metals. And usually if we fix all 5 of those categories, whatever autoimmune disease, whatever health issue is afflicting you, almost always inevitably goes away. So one of our promises to our patients, sounds like you've got something, one of our promises to our patients is after 6 months of treatment, you should at least feel 50% better, if not more. Now, if you're not doing your homework, we don't make that promise.
No. Yeah, and we've had patients where we weren't familiar with condition, but it is inevitable that if you're in here for one condition, you have every other one of the fingers being affected anyways. And if we can at least reduce that burden, I don't think we've ever had a patient come in with a condition we didn't know about that didn't get better by fixing everything else.
Yeah.
So.
And luckily, usually by the time people have those weird diagnoses or whatever, they've already come to us, already on a medicine that's not working, and they don't feel great. And so we're going down the functional medicine rabbit hole, and they'll have that specialist, and we'll work. That's actually one of the other questions. Can you work with my specialist? And yes, we'll work with your neurologist or your oncologist or wherever it may be, pulmonologist, in order that, okay, so I may not know about that one specific little pulmonary thing or lung thing, but that specialist can kind of handle that while we fix the root causes, and then ultimately you can come off that medicine, because usually that situation is reversible.
Right.
So Aubrey, here's a tough question.
Great.
Why do you think you can help me when no one else can?
Because we don't stop. We won't stop until we figure out what is going on with your body. But we look at every aspect of the whole picture of your body. We look at mental, physical, and emotional health. We look at every single basically compartment, I guess, of your health, and figure out what can be optimized, whether if it's through gut testing, whether it's through like lab testing, brain testing, you name it. We look at every single thing, and we won't stop until we find it.
What's incredible about the functional medicine field at this moment in time is it's made leaps and bounds in the world of testing. And so there's so many things that my predecessors of functional medicine doctors have been practicing and preaching for decades and had no, I shouldn't say no proof, but very little proof in the testing to prove what they were doing. Nowadays, we can tell you, hey, you've got fungal overgrowth, let's test it, and you can tell me I'm wrong. And maybe we are barking up the wrong tree. And so the beauty of it is that while we still have a long ways to go in testing the human body, the microbiome, and everything else, the cool part is we still have a vast amount of testing that can really help us give us the answer of where you're at. I'd like to see more, but the cool part is that we can test it. Unfortunately, a lot of functional medicine labs are not usually covered by insurance, but we at least try to keep the price down by bargaining with different labs and using the best lab for the best price.
Right.
Is there anyone that we can't help? The blank look, I'm assuming, there's not many people.
No, again, no. I mean, there's a small percentage of patients, which I'm sure that you can tie in on, of whether it may be cancer, whether it may be something. It's not that we can't help. We can absolutely improve your quality of life. We can remove the foundational elements that are affecting that. But there are some kind of conditions that we can't promise that we can actually reverse, and which I'm sure you're more familiar with.
Yeah, well, so the big one is cancer. That's always the big scary one, the big C. And currently in our practice, where we're at is our general statement is we do not promise reversal of cancer. Cancer is just a different beast. We will happily work with cancer patients, and we will do the best at making your body the healthiest possible. And if your body, your immune system identifies that cancer and kills it and reverses you, then hallelujah, we will be right along with you to celebrate. But that's not a promise we make to our patients. So any cancer patients that want to see us, we will support you and do everything possible to make your body as healthy as possible. And even if you don't reverse the cancer, you will feel better. And if you feel better, then it makes it easier to live with cancer and potentially live longer with that cancer. So that's one of the concerns. But to answer the more common person that thinks they can't get better is the person that continually gets worse despite seeing doctor after doctor. And usually, honestly, those people have some sort of ongoing exposure living in mold. I mean, that is the number one thing we miss. If people who are doing the functional medicine stuff, seeing functional medicine doctors and not getting better, that's the number one thing people miss. So if you think that no one else has helped you, why would we be different? It's because, as Aubrey said, we know our treatments work and we know you will get better. So if you're not getting better, then it really narrows down that you have an ongoing exposure, and we will help you find whatever that ongoing exposure is. And we talk a lot about mold, but toxic people, toxic humans in your life can be worse than mold.
Absolutely. And I think, and this is a little bit of an extreme statement, but there hasn't been a single patient working with us who's done their homework and done what we asked who has gotten worse. And if for any reason someone has gotten worse, it's because they're not doing the homework and they're not open to what we have to do. But any patient who is doing their work and agreeing with what our plan is for them, they at least can stop symptomatic worsening and always get better. They always get better at some point. And there may be someone watching this who's a little like, no, not for me, but you probably didn't do your homework.
That's true.
Yeah.
And not every patient works perfectly with us. So there's been some relationship. We're people too. And so there's some people that don't magnetically work with us as well and find other practitioners. But we do believe kind of our model could work for anyone and everyone. But the most important part is kind of your relationship with your provider.
Right.
You've got to trust your provider. You've got to believe in it, and you've got to move forward.
Yeah. One of the biggest things, real quick, I know it's probably not the question, is one of the biggest things that stand in the way of a patient getting better is their trust, because they've been misled by so many providers. We get it. I've been a patient. Uba's been a patient. We understand. And for a long time, and that was the mistrust that we had as well. And so what we do is we ask for your trust, as hard as it may be, because we won't stop until you get better. And I think the one thing that when anyone ever fell off, it was because they couldn't trust. They couldn't open themselves up fully. And we understand that. And we just ask to come back whenever you're ready. Because at some point you will be ready, hopefully. But
we ask you to do a lot of work.
Yeah.
And signing up is not just here, take a quick pill and see you later. We ask you to change your life.
Yeah.
And that's hard for some people.
Yeah.
That's hard for everyone.
You change your life, we'll change yours.
Yes.
Absolutely.
Deal. So that's enough for this video on how, if you're a good candidate for our practice, and pretty much, as Aubrey said in the beginning, anyone and everyone. So we look forward to meeting you one of these days.
Bye.